Hello and welcome to HIMSS TV. I'm Dave Moyle with Moby Health News. I'm here today with Skip Newberry, President and CEO of the Technology Association of Oregon. He'll be speaking at the Accelerate Health digital event in a panel named Smart Cities, Healthier Communities, which is really focusing on this concept of smart cities and how we can employ Internet of Things, public-private partnerships, and other 21st century tools to help try to transform disparities, bias across communities, access to care, and other important issues in our communities. So, Skip, these are very ambitious public-private partnerships that affect the communities, affect consumers and individuals, but really require a lot of collaboration and forward thinking from public entities as well as technology stakeholders and, from our perspective, healthcare organizations. Can you talk a little bit about what that side has to be considering to try and deliver the best benefit to consumers, and especially in the terms of healthcare?
In terms of healthcare, there's a lot of focus right now around sort of the consumerization of healthcare, and also another trend, which is sort of social determinants of health, a more holistic view of how is someone's health picture impacted by a variety of things: access to food systems, economic opportunities, stressors in the environment that may have an impact. And so much like in the smart cities arena, where you have policymakers and government officials looking at what are the various systems and how do they relate to one another, almost in a biological sense. It's very similar to how people are looking at individual health now. And so with this greater complexity, there is an opportunity to think about what role does technology play in providing better decision-making, more opportunities for intervention, both in terms of government providing better services and in the healthcare space for health practitioners to be able to provide both preventative health outcomes through data, better data shared with patients in a real-time capacity, and then also opportunities for intervention, whether it's mental health and wellness or whether it's things like more sort of emergency care situations. And in all of this, technology is the sort of great enabler. There's also, I think, some issues around with the collection of more data comes as well some greater responsibility. It's almost like the whole Spider-Man quip, right? With great power comes great responsibility. Well, data is kind of equated with power these days. And so when health institutions are thinking about the relationships they have with their patients, they want to be able to build a series of engagements beyond just something that's transactional. They want to have trusted relationships. And so it's very important in all of this to be, mindful of to what use is data being put and how accurately and precisely is that actually occurring in practice. And so by engaging patients more regularly, health practitioners have an opportunity to effectively get the patient more engaged in the actual prevention and delivery of care. And obviously, the more information that the health practitioner is provided with, the more informed they are and the better the decision making in terms of that person's care. So in all of this, things like the Internet of Things, so ubiquitous sensors that are being deployed in environments and in residences, as well as on wearables, are all things that have a tremendous amount of opportunity with them, but also some risk for practitioners if they don't get the sort of communications and data privacy protocols right. Some examples are here in Oregon, there's been a program called Orcatech that's been in place for over a decade now with Oregon Health and Science University, and they work with aging populations to provide Internet of Things solutions in residences to give them greater flexibility and freedom as they age, so that more interventions can occur in real time. There's preventative health outcomes that are achieved there. And overall sort of mental health and well-being is improved because people feel like they have more control, in a sense, being able to stay in their own residence as opposed to being in more of an assisted living type of an environment. So that's just one concrete example here locally about how the sensor environment and the Internet of Things is helping to transform this sort of delivery of healthcare.
And what were some of the barriers that particular implementation faced? Was it the privacy stuff that you were hinting at a little bit before, or were there some other problems that maybe were hurdles to overcome to reach those outcomes?
Well, I think in the early days, it was more about the sort of maturity level of technology, right? So being able to have the compute power necessary to make sense of massive amounts of data that is flowing over networks from a multitude of sensors in a built environment, in an actual residence. And you think about what it takes to actually, collect, house, and more importantly, make sense of the data as it's coming from multiple, dwelling units that are maintained as part of the program. And you can think of both sensors on like a wearable device someone might be wearing, coupled with those collecting information from the environment. That's a lot of data collected all the time, 24/7. And so as cloud computing has really evolved, the capabilities of data centers have really evolved, and also the data analytics capabilities and data science piece. That's hugely important. So one thing that's interesting is the Knight Cancer Center at Oregon Health and Science University was invested in by Phil Knight, along with many others, including the state of Oregon. And one of the goals of that program, in addition to cancer research, was the focus around genomic research in particular. And many of the companies that have started or been formed as a result of that research effort have been mainly focused around software and data science and analytics, and essentially making sense over the petabyte scale plus levels of data that are being generated from all of this. And it was much the same thing with Orchitect. The concept is really incredible, but the technology needed to kind of get to a point where it was cost effective from a deployment standpoint, and the ability of folks to collect and make sense of the data had to be efficient. And so those were a couple of initial hurdles. As the program evolved, it became more of a focus around data privacy, right? So there was more of a greater awareness socially of, well, there's potential harm in sharing too much data, and we should know as consumers about how our data is being used, toward what ends, and what's the data governance model, and so cybersecurity risks. And so all those things are now front and center with the Architect program. If you look at the website, it's really about sort of data privacy is paramount to the program. So those are some things that were obstacles over time, and how the program kind of evolved to meet them.